Hi, everyone. I'm Catherine Honeycutt, the Communications Specialist for BBB, and I'm pleased to welcome you to our BBB Business Builders webinar on medical marketing. Today, we have Dave Ory, President and CEO of Medical Leverage, and Jeff Morrison, the Vice President of Strategic Solutions at Medical Leverage, with us to help you assess gaps in your customer communication strategy, which will ultimately help you navigate this new normal of post-COVID-19. Some quick housekeeping notes before we begin. If you have any questions throughout the webinar, please feel free to put those in the questions box and we'll get to them at the end. So without any further delays, I'll pass it off to Dave and Jeff to get us started today. Welcome.
Thank you, Catherine. This is Dave Ory's voice, and welcome everybody to today's webinar session. As Catherine said, I'm part of a medical communications company by the name of Medical Leverage. And on behalf of everyone at Medical Leverage, we appreciate this opportunity that the North Carolina Better Business Bureau has extended to us today. While the medical communications market segment is unique and specific to healthcare, communications is central to all businesses. And the manner in which we used to communicate and educate on behalf of our clients to their customers, well, it changed almost immediately when this unprecedented pandemic virus hit. Believing that things will return to the way they were is one strategy to consider. Believing that what we've been through and the barriers that we've addressed and or are still addressing, and that this is only phase one, well, that's another strategy to consider. So this session this morning is meant to share some of our insights, our learnings, and our solutions that we've gathered and deployed over the last 100 days or so that maybe we can all improve our communications in this new world. Next slide, please. So today's agenda includes a very brief introduction to Medical Leverage, some insight as to why COVID-19 affected the market so uniquely, our thoughts on the current new normal, a brief case study, a quick summary, along with a free offer to those of you who are interested in talking more with folks from Medical Leverage. And we certainly hope many of you take us up on this offer. Next slide, please. Well, who's Medical Leverage? We're a North Carolina business that was established 19 plus years ago. Our employees are all North Carolina residents. We work in a highly regulated industry with national and international pharmaceutical, biotech, medical device, and medical diagnostic companies, helping them educate and communicate with their customers that use their products. We work in many different therapeutic areas with the products our clients manufacture. Next slide, please. What do we do? Well, we help our clients gather insights, build strategies, and create and execute communication tactics directed at their key audiences. The primary goal of our educational communications is to increase the comfort and confidence of customers that use our clients' products and services. Next slide, please. For our clients, we call upon folks within 4 primary areas of the company. You'll see those on the left-hand side. They include folks in the marketing departments, medical, training and development, and value and access. One of our most important objectives is to identify educational and communication gaps and address them with appropriate content and programs so our clients achieve measurable results tied to their original objectives. The customers our clients call upon are represented on the right, and they include healthcare providers, patients and caregivers, payers, scientific organizations, and researchers. While each segment there on the right side is important, they are all driven by the patient and the patient's needs. Next slide, please. As I've mentioned, our communications company helps address educational gaps surrounding our clients' products and services within the customers that they call upon. The types of services and capabilities we offer to our clients are listed on this slide, and they range from advisory boards, content development, training, and tactical program execution. Next slide, please. In order to execute for our clients with repeated success, we've hired people with industry experience. We've instituted core values and culture that promote business longevity. We've built structure and process and platforms so that we can deliver time and time again with great results. Next slide, please. A seismic market shift. We've used the word unprecedented, and it's used all the time in the news to describe COVID-19. Next slide, please. What makes the word unprecedented so appropriate is the totality of its reach when you consider the four main pillars of a macro environment: political, social, economic, and technological. All four were dramatically affected without much warning or preparedness. As we started to gather client, customer, and market insights back in late February and early March, these four pillars became quintessential to our approach and our thinking. Next slide, please. During a 3-week period in late February, early March, we spoke virtually with nearly 100 healthcare providers. We distilled our clients and their customers' insights down to four main areas: limited in-person access, limited virtual platforms in place, uncertain financial stability, and the prioritized needs of our clients' customers we're trying to educate and communicate with. Next slide, please. Let's first talk about limited access. As most of you know that are in this marketplace, almost all of the company representatives were pulled out of the territory. Healthcare providers were unable to see non-essential patients. Prior virtual interaction between the company representatives and healthcare providers, well, it may not have ever been established prior to COVID-19. Clients' policies and offices' SOPs, they were needed for business in a virtual environment. Most of the time, they didn't exist. Next slide, please. Limited platforms. With access diminished, the platforms were needed to communicate. However, offices may not have evaluated or established a telemedicine platform. They needed to do that very quickly. Further, offices may not have decided upon a preferred webinar provider. So things like GoToMeeting, like we're on today, or Zoom, they might not have had those platforms in place. And if they didn't have the platform in place, then they may not have established already the virtual processes and communications with patients that needed to go on and needed to be established. Next slide, please. The financial aspect of the pandemic immediately drove uncertainty and instability into both of our clients and their customers' day-to-day lives. Lower patient volume produced a question about how long could a provider and his or her office last at the overhead levels they were at. Would telemedicine be reimbursed, and for how much? And what were all the stipulations behind each of the available financial offers that were under consideration? Next slide, please. When we asked the healthcare providers what our clients could do to help them during this difficult time, they provided a few very poignant and specific answers. Information about patient support programs was important. Many of their patients had been furloughed or had been unemployed, so the financial assistance was very important. Patient education materials in a digital format. Since the healthcare providers were communicating now with patients directly over a virtual platform, it was necessary that the materials that they were counting on were also in a digital format. The ability to meet with other healthcare providers, to hear what they were doing relevant to particular business and practice issues was important. They wanted to know what they were doing was either right or should be changed or altered. They also had staff that in some cases were sitting around with some unused time. And so relevant training, including in-services, was very important. Armed with all this information, we met with our clients to share the customer insights that we obtained and trying to formulate a new game plan for 2020. Next slide, please. So at this point, let me introduce Jeff Morrison, who's Medical Leverage's Vice President of Strategic Solutions. He will discuss the rest of today's agenda with you. So I'm going to quickly say thank you for your time today, and I'll turn it over to Jeff at this point.
Thank you, Dave. And thank you all. I appreciate the opportunity to be here and on behalf of everybody at Medical Leverage. So I want to take a minute and really focus in on where Dave was driving. And that is, we've kind of talked about the macro aspect of this pandemic. And now I want to push into a little bit of kind of what the new normal looks like, because that is the consistent theme we've heard, is there is a new normal forming. And we may not have a complete picture of what the new normal is going to be long-term, but we certainly have a lot of short-term signs. And so with that, I want to focus in on the aspects that are affecting our clients and our customers, because we've all been thrust into this new world. It's forever changed healthcare communications, that's for sure. If you just look at some of the statistics as we push into this virtual world, email volume in the last 100 days is up over 200%. That's just a tremendous amount of increase and noise, frankly, that people need to cut through. So it's going to require a new level of excellence. But what we've definitely heard is this is a must way of working. And so we've got to figure out the path through this. And that's what we're working to do. And so communication style and content has to be adapted. In person, the communication can be a little more didactic, but it's being forced to be interactive. The attention spans in the virtual world are much shorter. Email science tells us that you have 3 seconds, and we'll talk about that more, but you have 3 seconds to get somebody's attention and hold it. And so, are we adapting to fit those things? And then do we have, as Dave discussed, the required processes and SOPs built in place? And then ultimately, a really nice halo effect has been the increase in individuals' technical skills. So, a year ago, I don't know about you all, but I was probably on somewhere between maybe 3 to 5 video calls a month. And now I'm probably on 3 to 5 video calls a day, and most others are as well. So we've seen this tremendous increase in people's technical ability to interact with these platforms and a willingness to do so. And that's certainly an encouraging thing. The Zoom statistics are pretty impressive. December, there were about 10 million daily users on Zoom. It peaked during the COVID crisis at 300 million daily users and has averaged out about 200 million daily users. So there's just a tremendous increase in flood into this virtual environment. And so then the implications start to fall out. What does that look like for different aspects of our programming and our customers' programming? And that's where we've spent the bulk of the time in our focus, and that's where I want to go next. So specifically with regards to content, content strategy is very important during this time as we think about amateurizing the content we have and adapting it for the needs. And content really all starts at one central spot, and that's what is the goal or objective of the content. And then it's the opportunity to take some reflection time and do a content audit, and as we like to say, run a gap analysis. You likely have the content in place, and many of our clients do. The content is there, it just may not be in the right format, or it may be missing a few pieces that need identified. And then what is the implication to the audience? From an identification and demographics of the audience, who is the audience? Where are they at right now? How are they engaging? And like I mentioned earlier, their consumption preferences, you have such a short window to get their attention, and it has to be engaging. Are you on the right vehicles and channels in the virtual audience to make sure you're engaging your audience the right way? And then it's about creating that content, filling the gaps, creating the content based on the right insights that have led to the right strategies that have ultimately formed the right tactics, and then deploying them. And then pushing to the next piece of this is the user experience. And I am one of those people that I really appreciate a good user experience when it's optimized. And many who know me know I love a good opportunity to eat at Chick-fil-A. And it's not just because they have great chicken and waffle fries. It's because they wrap a complete user experience around it, and they make you feel important and cared for all through that process. And that's something that really stands out to the audience here. And so we have an opportunity to do this and do this well and optimize that user experience. I like to say escape or they will. We all have an escape key on our keyboard. And the interesting thing about that escape key is we usually use it to get out of something we don't want to be in anymore. And so I use that ESC as an acronym to say we got to keep our user experiences easy, simple, and clean. And if we can do those things, they're more likely to stay engaged. And then, again, applying the content to the user experience, thinking about that user experience, chapterizing it versus booking. We don't know how people are consuming the data all the time. Are they, can they do a live program, or do they need more on demand? People families, frankly, are engaged virtually all throughout the house sometimes. You may have multiple people on virtual programs or calls, and this is true of the healthcare customers as well. And so, how can you surface content or put the right content in front of them at the right time, whether it be live or on demand? And how do you keep it interactive and making sure that there's enduring resources? And as we talked about earlier, we found ourselves using a lot of video recently, including studio produced video. I've heard stories of companies shipping out green screens to their employees and teaching them to almost act like a weatherman does in front of a map as they present material. And that's a place, a lot of this could be going. And so we're looking at the utilization of studio produced video and on-site camera crews. But we are all blessed with great webcams and the power of the computer that we have right now. The technology is really great. Had this happened 10 or 15 years ago, this may have been a very different experience with very choppy, pixelated video and things of that nature. But now, even with a simple device in our hand, we can take high definition video and have a meaningful interaction that feels very close and personal. And that leads me to personalization. Personalization during this time is really next level as we go virtual. When I have a piece of content that is written really for me or acknowledges me as an individual, it creates a stickiness that's a little bit different. And that's where we really want to drive. We want to create that really white glove customer experience that cuts through the noise and makes you feel that individualness. And that's some of the examples we've found ourselves doing is we're doing things like speaker or representative video invitation. So it has a personalized approach, asking them to come and join or participate in a particular program or learning engagement. we're utilizing things like apps to personalize content based on usage so that it's surfacing the right type of information at the right time. And so it creates, again, with that personalization, additional stickiness that should help drive deeper user engagement and satisfaction. And so it's led us to a lot of conversations with our clients, and ultimately we'd love to have that similar conversation with you. And I believe Catherine is going to surface a poll, if you will, that has these readiness assessments, and we'd love your feedback on these. But these are some of the questions we're asking our clients as we're going through these replanning processes. We're asking things like, obviously, did your 2020 plan change? You know, the whole world got shook like a snow globe. And so how's that falling out? What's changing as a result? And then it's about that time to be thinking about 2021. So what's changing as a result of that? And then really assessing the insights. You know, do we understand our customers? Do we understand where they're consuming information, or how they're consuming information, or what they're looking for, just to think of a few of the areas of insight? And then ultimately, what are the implications on the content as we translate to a digital virtual world? And are our programs, you know, different things ready for a virtual engagement? Can they transition that way? And really importantly, is my team ready for that virtual engagement? So with that, I want to transition into a bit of a case study and tell you about a situation that we've been working through with a particular client. And obviously this has been blinded, but we'll give you the essence of it. And through this situation, we were working with a team that has a great product, has great clinical utility. Unfortunately, it has low market share. And the reason it has low market share is the physician audience out there lacks proper dosing confidence. And that's because the dosing is a little bit confusing to either start a patient or convert a patient. And so there's been a need to increase that level of competence. And so there's an educational gap that's clearly been identified, and we've been working on with different programming. And so pre-COVID, the plan was about educational programming, live programming, in person, either in the office or at outside venues, and largely driven by in-person recruitment. Well, as we've just discussed with the conversation about the environment change, in-person isn't available, certainly not as available. Only just now are certain in-person interactions even starting to come back. And so it had to change. And so what happened? Well, we started the process with gathering the right insights. And so through our ML Blueprint process, we started to gather insights through advisory boards and one-on-one meetings to make sure we really understood how this needs to transition. And then it was about changing the content through our ML Solutions product to make sure we prioritize the content, chapterize the content, and adapted this content to a virtual setting. And then it was about changing the platform. So we had the opportunity to implement a mobile app to go with our Speaker Bureau platform that allowed for a different level of engagement. Again, going back to some of that personalization, it allows us to do push-pull notifications once they're in there and automate some of the recruitment efforts. And it also allows us to surface materials or different types of programming as they become available. But what had to change was the content couldn't stay the same, the program couldn't stay the same, it couldn't stay in the longer form and the live form. So we had to change, and this was an opportunity for us to use a platform to help implement that change. And then it was about communications changing through the different types of internal and external communication plans. And the fact of the matter was there needed to be some recruitment assistance. It couldn't be that in-person recruitment. Now the rep is still working in an in-person environment, but in a virtual way. So it's not truly in person, but they are trying to work virtually. But they need help. They need assistance in that. And so that was an opportunity for us to come in and write a communication plan and implement a communication plan through our various platforms and processes. And ultimately, it became about training the speakers that were going to be educating on behalf of the brand. So taking the new content that was created, using the new platforms, and then training them on the changes that were being implemented and the different types of programs that were being created as a result of taking that longer form content in the beginning and breaking it into the necessary sections to stay hyper-focused on the educational gap that was there, and then launch those programs. And that also had to involve training and mobilizing the internal team. We needed the virtual representative to be up and running, and we needed to not only help their recruitment, but help get them excited about advocating for it. And so what you're seeing through here is really, a complete holistic process where we had to convert this whole program from really a very in-person, type of experience and completely change it to a virtual experience where we chapterized and chunked and deployed and really supplemented and drove a lot of the recruitment for the organization. And so the goal was to make sure we had all our bases covered and really leave very little to chance, frankly. And so we're enjoying watching this program right now and seeing the results as they're coming in. And so in summary, I want to close with just, again, this has been an unprecedented event. COVID-19 has really shook up everything, and especially with healthcare communications. The old in-person model has been rendered almost completely obsolete overnight, and the new normal is forming. And so, we know that it's virtual and it's digital, and we need to have our content ready, and we got to have the right platforms and apps in place. And we've got to be thinking about the audience and how they want to engage with that, making sure it's personalized and interactive and engaging for them. And ultimately, that it's creating the right educational transfer. And so we feel like we're uniquely qualified, and we love the opportunity to engage with you and your team. And so we are offering, as a result of this opportunity, a 1-hour free consultation, and we'd love to give you the opportunity to schedule that. And so I'll pull up this last slide, which gives you 3 different ways to schedule that. And again, we'd love the opportunity to engage with your team. And on behalf of everybody at Medical Leverage, we're just really thankful for the time that we've had to spend with you today. And with that, I believe we're going to turn it over for some questions.
Awesome. Thank you so much for that. And just a reminder, I want to go back earlier when Jeff was mentioning that link to a poll for you guys. I put that in the chat box, so be sure to look for that link. You can click on it and complete it there. And also, if you do have questions at this time, you can go ahead and put those in the questions box. We already have a few, so I'll go ahead and start with the ones that are in there. The first question we have is specifically about medical leverage. It asks, what makes medical leverage unique?
Well, I'll take a swat at that, and Jeff, if I miss something, by all means, chime in. I think it starts with the people and the experience that the people bring when they join Medical Leverage and the experience that they gain working with Medical Leverage. I think it also starts with the mentality of being a solutions provider and not just a problem identifier. We also have a group of folks within our employee ranks that have a high need to please. So they're not ones to stop working before the result is had. We've instituted a number of proven processes that help to invoke successful repeatability. And I think that's very important for our clients. They need to know that this isn't theoretical, this is historical information that we're sharing with them based upon prior programs and experiences that we have. And I think we've also done a very good job of innovating our platforms to allow communications at all levels, so that we know we work in a highly regulated area. Reportability, audit, compliance is a huge part of what we do day in and day out. And we try and take that into consideration when we're bringing platforms to bear. So I think that part, Catherine, may help answer that question.
Awesome. Thank you for that. Another question we have in says, if access remains limited, will industry representatives be needed in the future?
Jeff, you want to take that one?
Sure, I'd be glad to. Thank you. Yeah, it's hard to say what the role of the representative will be in 5 years. I think if you look back over time, that's something that has been hypothesized multiple times, is what is that going to look like? I don't see the role of the representative going away, but they do need to learn how to establish a virtual relationship, and that is probably the most important aspect of it. is that they need to learn how to work in this new world, and the right platforms and processes and assets for them and training really, I think, will all help bring that home. And so I think it's hard to know where they'll be in the future, but I know they're here now and they're needed. And I don't think that's going to change, because the role of education transfer really doesn't go away from a person-to-person interaction. And ultimately, the person with the best access to that information is the representative.
Awesome. Thank you for that. Another question we have in says, it looks like you do a lot of things at Medical Leverage. What would you say your strengths are?
Well, maybe we'll go back and forth, so I'll take that one, Catherine. I think a long time ago, somebody shared a cliche that has stuck with me and with us, I think, as a company, that you can have a good strategy, but execute poorly, and the outcome is going to be a not so good result. The flip side of that is you can have an average strategy, but execute flawlessly, and you're more than likely to have a very good outcome. So I think it starts with flawless execution. Would be a strength of ours. I think that we do a very good job in creating very good strategies, and and I think that we're fanatics towards the details, which helps with allowing us to execute flawlessly.
Mm-hmm. Okay, awesome. We have a question that's a little bit more on just the nature of how things have changed and how maybe they'll change in the future. And so it says, even with a vaccine, will things ever go back to the way they were pre-COVID outbreak?
Jeff, you want to take that one?
Absolutely. Yeah, the concept of the vaccine has been a discussion, obviously, in the macro environment, the broader news. Will it make it go back to normal? And with regards to really that and healthcare communications, I think we've all heard loud and clear that things won't go back, even with a vaccine, all the way back to what they were pre-COVID. We've heard great feedback with the telemedicine strategies that are in place now, and that the virtual relationship with the physician is really here to stay. I think that's the virtual environment is only something that is going to continue to grow and bolster. And all of this really last 100 days was just a huge acceleration towards that. So I don't see anything going back to kind of the way it was. And that's, why we stress so much the new normal, because I do believe there will be a new normal that forms. It may have elements of the old, but I think we're going to definitely see a very different new.
Okay, great perspective. Another question we have, still kind of along the same lines, it says, if representatives are not in the healthcare providers' offices, how will physicians receive promotional product education? So kind of about that structure and how things have changed.
Yeah, I think that physicians have already found their way to online sources that are going to give them the information that they need. So I think it's up to medical communications companies like Medical Leverage and their clients to make sure that they gather these insights and they build the right tools. So that makes it easy for the healthcare providers to get the information.
Right. Okay, great. While you were talking, we got a question in about how do I train employees on this different new? So do you have any advice for that, or just trying to navigate this and making sure that your employees are educated and up to date with the most current information so they can do their job? Do you have any tips for that?
Jeff, do you want to take a swat at that first, and then I'll chime in.
Yeah, absolutely. So if I understand your question correctly, it's how do we train employees for this? And there's a lot of aspects just basic to training that obviously we need to take the approach of. But the first is just constant communication. I think a solid communication plan about what is being learned and what this is going to change, and staying really current with your team is super important, and creating a structured training plan that allows them the opportunity to become not just proficient at virtual platforms, but really gain a level of expertise at it, a confidence. And so, one thing we do at Medical Leverage is I like to use a lot of, kind of illustrations, and I'll use a sports one now. It's not just about teaching like baseball and, taking batting practice, but it's about getting game experience. And so that the first time they're having a virtual interaction or a new interaction in this new world, it's really not the first time they've done it. And so for us, our philosophy is making sure that they walk out there capable and confident.
And I would
Awesome.
just add,
Thank you for that.
I'd add to that, pardon me, Catherine, I'd just add to that and say that it begins with understanding where the sales force is, right now, and where they need to be, and then determining a plan and a training curriculum in order to support the gap that's between where we are and where we need to be.
Okay, great. Another question we have says, I don't have a large budget. What should my focus be, and where should I put the funds that I do have? So could you guys provide any advice on if there's one area that should be the first focus? What would you say that is for someone who may have a limited budget?
That's a big question that probably deserves 3 or 4 other questions before it can be answered thoroughly. I don't know enough about where they are right now with if they are trying to make an outreach towards healthcare providers. If they feel like there's a deficiency with training internally with their representatives. So would love to go a little bit further, with that person and trying to better understand exactly what they're hoping to accomplish. But I would say this, working within budgets, be they limited or tight, is something that Medical Leverage has grown accustomed to over our 19 plus years.
So would you say kind of what you were hinting at would be to kind of figure out what is your primary goal, what's your primary need at this moment, and then kind of assess, your budget in that direction. Maybe there's not a set, this is what you need to do first in every situation. It's more about where you're at and what your business needs right now, and that could change, right?
It's exactly right, Catherine.
Awesome. Okay, cool. Another question that we have says, on the flip side, from a provider standpoint, what do I need to do to make patients more comfortable with virtual interfaces? That's a good question.
Jeff, you want to try that on?
Yeah, it's an interesting question. Virtual is one of those things that if you've not had a lot of experience, it can feel foreign early. But I think a lot of it comes through the care and concern and the way they're communicating with their patients. And so and I know providers do this so well, but it is that kind of extra comfort that this is this is okay, this is new for us too. We're kind of in this together type of format. But really just a comforting voice and communication. And I would tell you that the number one thing I hear personally from friends, family, and within the industry is that when somebody is communicating frequently, there's an added level of comfort there. And so I would probably yield on the side of over communicating to make them feel comfortable. And a lot of it's going to depend on what they're uncomfortable with. But again, frequent communications and access to people to answer questions is only going to help that. That would be probably my best thought there.
Awesome. We got kind of a follow-up after they sent that one that says, any advice on how to market these virtual interfaces with clients or patients to make them feel more personable and comfortable with the situation?
Sure. I guess just a point of clarification. So market to the healthcare providers or market to the patients, Catherine? Does it?
I think they mean both, because it says to market with clients or patients. So it could be those, with your actual patients, or also with those groups that you work closely with.
Sure. So can I ask you just to read the question again for me one more time?
Sure. It says, any advice for how to market these virtual interfaces, so, having to do things online as opposed to in person, with clients or patients to make them feel more personable and comfortable? So to make sure that, kind of like what the last question was about, just navigating having to do everything online. Do you have any advice for marketing this, or maybe messaging would be a better word?
Sure. So I would say a couple of things. To the healthcare providers, I think we mentioned in the presentation, an area that we've done is personalize peer-to-peer communication through video clips. So, a speaker who's been trained, when they're scheduled for an upcoming virtual event, we've been able to use some very abbreviated video clips to help provide a brief overview and to invite, targeted audience folks to an educational event. That seems to have worked very well. I think, as Jeff mentioned also, we've chapterized. So we've created smaller versions of programs where it used to be 45 minutes or so. We've created 20-minute programs. We've also created things like Ask the Expert programs, where you're allowing, through a compliant way, a one-on-one or a smaller group of folks to come with a specific issue, and obviously guardrailed by product label. But you're allowing that more personalized interaction to occur. With patients, we've worked with advocacy groups that have monthly meetings that are already transitioning patients towards virtual platforms, and helping to bring either patient education through a speaker. It could be a healthcare provider or another patient, and that seems to be also a very big draw and a good draw to helping to transition folks towards that virtual platform like you were talking about.
No, that's great. And we have another question kind of along the lines of this virtual shift. And it says, what is the typical time frame to shift current programs or materials to virtual? How quickly can we modify?
Sure. It's a good question, and it has some tenets that are tied to the individual company's promotional review committee, and their willingness to take approved content and chunk it or chapterize it. And so it's dependent a little bit upon that internal review policies. But the actual standing up of transitioning a live program to a virtual program, we've done in as short as 3 to 4 weeks, and as long as 8 weeks, in order to get things done internally, provided that the content already exists for the promotional deck. And now it's just a matter of changing invites, making them more digital friendly, like in HTML5 format. So great question, and one that when we go through the content audit, as Jeff was describing, it's an area that we certainly look at so that we can provide more insight around the question that was asked.
Okay, great insight there. Thank you for that. Another question that we have says, what is your account and client management philosophy?
Sure. Jeff, you want to take a swat at that?
I'd love to. Yeah, as Dave mentioned a little earlier, he talked about how fanatical we are, and this is one of those things we're fanatical about. and that is that we really want a very close partnership with our clients. We want to become an extension of their team, and we really aim ourselves to provide white glove service that forms the word partner in people's mouths. That's not something we'll say about ourselves. We assume ourselves to be a supplier until the client looks at us and calls us a partner, and that's when we know we've done it right. And so, our goal is to always earn the partner badge, and we do that through, really providing meaningful action and results along the way. And so, I think that's probably our philosophy. Is our goal is to achieve partner status, out of the words of our clients.
Yeah, that's a great approach, and keeps you motivated too, I'm sure. So that's awesome. Actually the final question that we have that I see is about your specific services, and it says, what therapeutic areas are you an expert in?
So, Catherine, as you can imagine, over a 19-year history, we've worked in many, many, many therapeutic areas. I'd say that we have a strong foothold in areas like central nervous system, so CNS. We've worked on a lot of different disease areas within CNS, everything from spasticity to migraine to restless leg to Parkinson's disease to MS to ALS, just to mention a few. We've worked a considerable amount within cancer in all the various forms. We've worked quite a bit in respiratory. Many of us came from a pharmaceutical company and worked on respiratory products. And we work quite extensively these days in a rare disease marketplace as well. So those are kind of the four big ones, but we've worked in many others.
Well, great. Well, Jeff, Dave, thank you so much for your time today. Those are all the questions that have come in, but if anyone has any other questions, please feel free to visit their website or contact them to learn more about medical leverage. And, if you have specific business questions that you want to ask them, be sure to reach out to Jeff and Dave. But I thank you both again for your time. And just a few reminders before we wrap up today, that those who are listening, if you would like to go back and listen to this again, it will be available on our YouTube channel, and you can find a full list of upcoming webinars and past recordings at bbbevents.org. So be sure to search for them there. And thank you again for those who joined us. A special thanks to you and Dave for sharing your professional insight with us today, and I hope everyone has a great day.
Thank you, Catherine.
Thank you.